COVID infections have fallen by almost a third in 1 week, data shows. The Office for National Statistics, ONS, estimates that 481,300 people had COVID in England in the week to February 12, the equivalent of 1 in 115 or less than 1% of. It's a 30% decrease from the estimate the week prior, of 695,400, and it is the lowest figure since November 29 to December 5, when the estimate also stood at 1 in 115 people. Infections also went down by around 30% in Wales and Northern Ireland, to 24,600 and 17,800 cases, respectively, and 17% in Scotland, to 29,000. The promising data is yet more proof that the COVID outbreak is shrinking, and bodes well for this weekend when the Prime Minister sets out the roadmap out of lockdown. Boris Johnson's announcement on Monday evening is set to reveal schools will open on March 8, and the reopening of non-essential shops will follow in a cautious move to lift. It comes as widespread decline in cases. The Office for National Statistics, ONS, infection survey swabs thousands of people every week to track. It does not give estimates of people in care homes, hospitals or prisons, only private. It found that Northwest England had the highest proportion of people of any region in England likely to test positive for around 1 in 85 people in the region were estimated to have had COVID-19 in the week ending February 12. For London the estimate was 1 in 100, and for the West Midlands it was 1 in 110. The other estimates are 1 in 120 people for the East Midlands and for Yorkshire and the Humber, 1 in 125 people for Eastern England, and 1 in 135 for Northeast England, Southeast England and South. In Wales, around 1 in 125 people are estimated to have had COVID between February 6 and 12, down 1 in 85 for the previous week. In Northern Ireland, the ONS estimates around 1 in 105 people had COVID between February 6 and 12, down from 1 in 70. The estimate for Scotland is around 1 in 180 people, down from 1 in 150. A long way to go. The data adds to a slew of research finding a continued drop in cases over several weeks. Yesterday, figures published by Public Health England, PHE, revealed that 99% of areas have witnessed a drop in infections, and data from NHS Test and Trace show that there has been a 29% drop in positive COVID. Despite this, experts say there is still a long way to go. SAGE has said the prevalence of the virus needs to be more like 50,000 a week, 10 times lower than the ONS says they currently are, before the PM can consider easing. That's according to NHS Providers Chief Executive Chris Hopson, who said on Wednesday there was a pretty clear view that number needs to come down to around 50. Meanwhile, researchers on the largest test survey in the UK said coronavirus rates are. The REACT study, by Imperial College London, found that lockdown had caused cases to plummet by 2. Around 52 people per 10,000 are testing positive for the virus now, which is similar to the rates we saw in September. Scientists hailed the plummeting cases as really encouraging yesterday, but warned pressure on hospitals must ease before we unlock the country. Meanwhile, the researchers of another study tracking the outbreak using app data said the pace at which cases are falling. According to the Zoe COVID Symptom Study UK Infection Survey figures, there are currently 14,064 daily new symptomatic cases of COVID in the UK. This compares to 14,818 daily new symptomatic cases a week ago, a decrease of only 5%. The data only include people who report symptoms to the app, therefore missing any asymptomatic infections. Professor Tim Spector, an epidemiologist at King's College London who leads the study, described the trend as a hitch in the progress to beat COVID. Since the peak of 69,000 daily new cases around the 1st January, cases have fallen by around 80%, according to the app.